Good day, and thank you for listening. Today, I'd once again like to talk to you about the coronavirus that we've all read about, a worldwide pandemic. We know today, as of today, there are no confirmed cases in Haverhill and only one confirmed case in all of Essex County. But we also know we can't take any chances. We know that the most vulnerable populations are the elderly and anyone who's had a pre-existing respiratory problem. I know that a number of senior citizens listen to this broadcast, so I'm directing this broadcast to you. If you're experiencing symptoms, I want you to get checked right away. The symptoms to look for are shortness of breath, fever, and a persistent cough, particularly if you've been in contact with anybody who's confirmed to be been affected. If you or people you're in contact with have traveled abroad, particularly to affected areas, or if you're experiencing these symptoms and you're elderly or sick, call your doctor or medical provider and ask to be tested. If you're experiencing a medical emergency, call 911. Now, whoever you call, if you're calling to be tested about the coronavirus, make sure you tell them what your symptoms are and that you want to be tested for the coronavirus. They'll make arrangements for the personnel who pick you up if you need an ambulance or test you if you go to the doctor or hospital to wear safe protective gear. We have to make certain that our first providers, police and fire, our ambulance personnel, and our medical personnel are as safe as possible so they can continue to protect you. Now, the problem is the symptoms I mentioned are the same symptoms as the flu. So if you have these symptoms, do not panic. The people who have been tested so far have the flu, not the coronavirus. But we want you to be safe, but we don't want to panic you. What all the communities are doing right now, including Haverhill, is to take steps to prevent the pandemic virus from spreading if it comes to this area, so that it doesn't overwhelm our medical system. The virus only spreads, as far as we know right now, through droplets, not through the air itself. So we know that by isolating people, we're going to slow this down. China took extraordinary measures, some of which we can't and would never take here in America, to isolate millions of people, and the spread of the virus there has slowed considerably. What we're doing in Haverhill is we're canceling a number of public gatherings in order to be cautious and to protect you. We've canceled the Council on Aging St. Patrick's Day party. We're canceling bingo. We've canceled a number of events, both at the Citizen Center and at the public library. We're making efforts to make certain our schools, our public places, and our city hall are thoroughly washed down and thoroughly disinfected. We're making contingency plans here at City Hall for our government to continue in the event of an outbreak. We're most concerned for our emergency response teams so that they can continue to respond. And both the police chief and fire chief are working on this. And I've asked every department in the city to work on contingency plans if their building gets shut down, if a large number of their personnel end up being quarantined and out with the virus. I know that many of you must have a lot of questions about your own individual health and about the coronavirus. Questions about your own health should be directed to your own individual physicians. But if you have questions about the virus itself, I want you to get your information only from reliable news sources, not from Facebook and not from a number of false information pieces that are out there on the internet. The best source of information is coronavirus.gov. That's coronavirus.gov. That's put out by the Center for Disease Control. I'll be back next week to tell you more about this. We're doing everything we can here in the city of Haverhill to keep you safe. Keeping you safe is our number one top priority. Again, there's no known cases right now in Haverhill. So let's all take precautions. Let's be prepared, but not panicked. Thanks for listening.